All right, we are rolling. So thanks everyone again for joining tonight. I'm so pleased to introduce our presenter for tonight, Dora Guardado. She has been a nurse at City of Hope for 10 years and in oncology for 14 years. So she knows this work through and through. I was also telling Dora that I facilitated a number of patient and caregiver groups over the years, and time and time again, all the patients that I interact with say that nurses are an amazing resource. They know all the tricks of the trade for managing treatment side effects. So we are so pleased to have Dora join us tonight. And with that, I'll hand it over to you, Dora.
Thank you so much, Rachel. Hi, everyone. Like Rachel mentioned, my name is Dora. Thank you for joining us tonight. And I want to thank Cancer Support Community for inviting me to give this presentation to help patients with managing side effects while they're receiving treatment. This is very near and dear to my heart. I thoroughly enjoy what I do, and I'm hopeful that whether you're a patient or a family member support giver, that you learn something and take something home from this presentation. So welcome, and thank you so much for joining us. I'll go ahead and get started. And as Rachel mentioned, you can ask questions at any time during the presentation. I'm open, and I will also stay a few minutes late to take questions at that time as well. So first I'm going to start by just mentioning or going over what chemotherapy is a little, because this is a background to side effects, how they occur, and how we can help manage those. So chemotherapy is a cancer treatment which uses the drugs to destroy or control the growth of cancer cells. While it's doing that job of destroying or suppressing the growth of those cancer cells, at the same time, it is also affecting the normal cells within the body. The chemotherapy pinpoints the rapidly dividing cancer cells, but it doesn't differentiate from the normal rapidly dividing cells in our body, which are throughout our body. And I'm going to go over those with you. So a little bit of science in here, just so you understand the reasons for the side effects and how to manage them. So as I mentioned, it does affect normal cells, and that includes our blood cells, which is the red blood cells, our white blood cells, and platelets. And I'll go a little bit more into detail with those a little bit later. Also, the cells that line our gastrointestinal tract, and that's from our mouth all the way to our bottom, all the cells that line that are affected by chemotherapy treatments. And as you're going to see, a lot of our side effects occur in those areas. And all these areas that I'm going to mention is where a lot of the side effects start. Hair and skin cells, reproductive cells, and nervous system cells. Those are the major major systems in our body that are affected by the chemotherapy. So just keep in mind that everybody who's receiving chemotherapy treatments is different. Everybody's getting treated for a different diagnosis, or you might have the same diagnosis but different treatments. But everybody will be receiving different treatments, and everybody will react differently to how they receive these treatments. Each one of us is unique, and we all have our different ways of dealing with certain things. So just keep that in mind. A lot of patients tend to tell me, oh, my friends went through chemo and they had all these issues. And I just have to remind them that, you know, everybody is different. Let's see how you go through this journey and how we can help you. So, and not everyone gets every single side effect. Some patients might be prone to more side effects, and some patients may have minimal side effects with their treatments. But just know that all side effects are manageable and can be minimized. In my years of chemotherapy or being an oncology nurse, there have been advancements in medications for these side effects, and they work tremendously well for these patients. And I've just seen the change from starting my oncology career to now, and patients are tolerating treatments well because of these advancements in these anti-nausea medications and other medications to help patients get through their treatments. So some of the common side effects that we see, and I'm going to go through each one of these as just to give a little insight on each. So hair loss, as most of us know, skin and nail changes, nausea and vomiting, diarrhea and constipation, infection, infertility and sexual changes, nervous system changes, fatigue, anemia, bleeding, and loss of appetite. These are all major things. As I mentioned, not everybody gets all of these side effects. So keep that in mind. I don't want to scare anyone. So we'll start with hair loss. And hair loss does depend on the chemotherapy drug. I'm going to stop right here. I wanted to mention that there have been advancements in treatment for cancers, as you may have heard, or some of you may be on some immunotherapy together with your chemotherapy. And immunotherapy is more like a targeted treatment where it goes straight to the tumor or cancer cells and destroys those without affecting the other cells in the body. So with immunotherapy treatments, we see very little side effects with these medications, and patients are doing tremendously well with them. We have a patient on an immunotherapy who is on cycle 86 of his treatment. So he has been on that treatment for years, and he still is doing really well. So immunotherapy is one of the advancements that have come through for cancer treatments, and it is doing tremendously well. So there's very minimal side effects, so I'll be focusing on chemotherapy treatment side effects at this time. So back to hair loss. It depends on the drug that you're receiving. Some chemotherapy drugs, we know for sure you're going to lose your hair within 2 weeks of receiving treatment. And then there's other drugs that will cause hair thinning or no hair loss at all. So it varies. But as a nurse, if I know that one of the drugs you're going to be receiving is going to cause hair loss, I will definitely let you know so that you can be prepared. One of the things is if you plan to buy a wig, the best time to do so is when you have hair, because they can fit you, they can match your face to your normal regular hairstyle. So that's an important thing, and a lot of women don't know that. And so they'll start chemo and then they look for a wig, and it's a little more difficult for them. Hair loss does occur 7 to 14 days after your first treatment. It starts to just gradually fall out, and then women say they wake up one day and the hair is on the pillow. So a lot of women shave their heads, or even men, or they'll cut their hair very short to eliminate that trauma to them. So how do you manage hair loss? You still need to keep your scalp and your hair clean. It's very important. You wash your hair gently if you have thinning of the hair. They recommend using mild shampoos like Aveeno or Neutrogena because those are mild to the scalp and also to the hair that's still in place. Because the head loses a lot of heat when you don't have hair, it's very important to wear a hat or a scarf to keep yourself warm, because your body will also be cold if your head is cold. So it's very important to keep your head warm. Also to protect your head or your scalp from the sun, because as we'll mention later, your skin can be very sensitive to the sun while you're on chemotherapy. Of course, we want you to, if your hair is thinning, avoid using curling irons or hair dryers, clips or hair bands, and no dye or perms for your thinning hair, because that will just damage and could do damage to your scalp as well as the remaining hair. The best part about this is your hair loss is temporary and it does grow back. And when the treatment's completed, in a couple of months, you'll have nice short hair. But honestly, in all my years of oncology, when the women come in without hair, they look so beautiful because their faces are just glowing. And I tell them that all the time. It's really important that they know that they are beautiful even without hair. So that's just something I've learned. We also see skin and nail changes, skin being the largest organ in our body. The chemotherapy does affect it with rashes or itching. Sometimes you'll have peeling of the skin. Certain chemotherapy drugs can cause peeling of the skin on the hands and feet. Skin can become discolored around your nail beds, your joints. For some reason, the joints darken. Even the knuckles of the fingers can get discolored from chemotherapy. As I mentioned, your skin will be very sensitive to the sun. So we recommend SPF 50 or higher. And now with the winter coming up, protect your skin with long sleeves, scarves, your scalp as well. Um, and the changes to the nails and the nail beds. The nails become very brittle or thin. They break very easily. The nails can also become discolored from chemotherapy. What the main thing with your fingernails is to prevent infection from setting in. If your skin is cracked around your nail bed, or if your nails cracked, make sure your hands are clean at all times. Wear gloves while you're doing dishes or cleaning or gardening. You want to prevent any infection to come in through the skin or a break in the skin or the nail bed. A good way to keep your skin healthy is to stay hydrated. Use moisturizing soaps. Apply moisturizer or creams when you exit the shower and you're dry. That'll help hold in the moisture on your skin. If you're outdoors, wear a wide brimmed hat, as I mentioned, with the long sleeves and pants. Um, just to protect your skin from the outdoors. Um, and as I mentioned, wear gloves when cleaning or doing dishes to protect your skin as well. So nausea and vomiting. This is a side effect that we do see often, more nausea than vomiting. As I mentioned, the medications that they have now for nausea are very, very effective. And so we really don't see much vomiting anymore. I'm not saying it doesn't happen, but it's very seldom that we see that. The nausea is well controlled with the medications given. It's not a side effect of every drug. And it's really important to have your medication on hand before you start chemotherapy. Because once your nausea sets in, it tends to take a little bit longer to get under control. So have that medication with you before you start your treatment. It's really important. Nausea can be immediate, meaning you can start getting nauseated hours after your treatment, or it can be delayed where it comes a day or two after your treatment. But you want to have a good plan in place on how to take your nausea medications, and talk to your doctor. It's really important because there are a lot of anti-nausea medications out there that can help you. So if the one that you're taking is not effective for you, let your physician know, because they can always prescribe a different one. There's, like I said, there's several that they can prescribe, and you just need to find the one that works for you. But it's really important to, if you take care of your nausea at the very first sign of nausea, you can control it. If you wait a little long thinking it might go away, it tends to take a little bit longer for it to resolve itself. So keep that in mind. So some tips on what to do with nausea and vomiting is to take the medications as directed. If you're having nausea, eat bland foods, dry toast, crackers, white rice. The key is to eat small, frequent meals and snacks instead of the regular 3 large meals. It will help keep something in your stomach at all times and kind of reduce the nausea. A lot of times nausea occurs when the stomach is empty. And I know that there's times when you don't have an appetite to eat, but it's still important for you to have something of substance in your stomach to prevent the nausea and hold it at bay. Ginger ale is excellent for nausea. Ginger ale, they also have ginger chews, ginger gum. All that is very effective for nausea. And the reason we ask you to let all the bubbles go out of those drinks is because the bubbles will fill your belly and may cause the nausea to become more severe with that. So let the fizz go out of the ginger ale or the Sprite before you drink it. Avoid strong smells, perfumes, or alcohol. If somebody's cooking something and you're nauseated, the smell is just going to tend to make it worse. Sit up after eating so digestion occurs properly. It'll help ease that and go through the system and reduce nausea as well. Avoid doing anything strenuous after you eat. Kind of relax. If you're having trouble eating, a good thing to do is to have some ice chips or a popsicle. That way you're getting some fluids in and it'll help keep your mouth moist. And again, if your medication for the nausea is not working, please notify your physician and let them know.
Dora, there was one question in the chat just asking about products for skin and nausea. So I'm assuming like medications or topical products for skin, if you have any recommendations.
For the skin, it's just basically moisturizers, creams. In regards to medications, it would depend on what type of skin issue you're having. If you're having a rash, the doctor might prescribe a hydrocortisone cream. If there's cracks in the skin, they might prescribe something like an emollient to keep those moist and help them to heal. So it's important to not really get to that point, to keep your skin as moist as possible, and use the creams and the lotions, preferably without alcohol, because if your skin's rashed or cracked and you use something with alcohol, it's going to burn. So you can look for those products at any Target or Walmart or anywhere like that, to find products without alcohol.
And any medications for nausea?
Over the counter? Is that what the question is referring to?
It just said products for nausea. So yes, prescribed actually.
Okay, prescribed. Well, there's several prescriptions for nausea medication. The most commonly used one is Zofran or ondansetron, which works very well. Usually patients just need that one. But sometimes the doctors will order 2 or 3 anti-nausea medications, so you can kind of juggle them around to control your nausea. And the doctors will also prescribe according to whatever treatment you're receiving, because there are some chemos that are cause more nausea than others. So they will know which anti-nausea medications to prescribe for you. I
Thank
hope
you.
that answers your question. Yeah.
Thank you. And then somebody else did ask if you have any shampoo recommendations.
The Avena one, and only because I've heard like 2 patients mention it, that they liked the way that one worked best on their scalp. They had lost all their hair, but they still used it on their scalp, and they said that it really soothed the scalp and kept it hydrated. So, and that's from patient feedback that I heard.
Great, thank you.
You're welcome. So diarrhea is one of the side effects. As I mentioned, the chemo affects the cells in the GI tract. So diarrhea is a common side effect that we see, and it is manageable sometimes with over-the-counter Imodium. However, it's when your stools are very watery and frequent, it's when you should notify your doctor. We do expect soft stool after chemotherapy. That's common because of the medications you're receiving. But when it becomes very watery and very frequent, that's when it's concerning. However, when you do get diarrhea, we want you to increase your fluid intake, because you can get dehydrated very quickly with diarrhea. So water with electrolytes like a Pedialyte, Gatorade is good. I forget the other brand that's out there, but broths, chicken broth is good to kind of replace those electrolytes that you're losing with the diarrhea. It's really important. And water is really important. You're going to see that on a few of my slides. Water intake is really important during treatment. So be mindful of that. It's going to help your skin. It's going to help your GI tract. It's going to help with diarrhea, with constipation, with nausea. So water is really important. You're going to see that in all my slides. With diarrhea, also continue to eat the small, frequent meals. Foods that are high in sodium and potassium, so avocados, bananas, sweet potatoes, canned soups have a lot of sodium. That's a good replacement when you're having diarrhea. Um, we want you to avoid any spicy, fried, or fatty foods because that's not going to help your gut while you're going through this. And milk products aren't good when you're having diarrhea as well. So sour creams, cheeses, regular milk, or ice cream, avoid as well. If your diarrhea lasts for more than 24 hours, and as I mentioned, if it's that loose, watery stool, really important for you to contact your doctor and let them know. You can take over the counter Imodium, and if that's not effective, then notify your doctor. Sometimes it is effective just with one dose. So, but just know that you should contact your physician if it continues for more than 24 hours. So constipation, again, water is really important, will help with digestion. If you have constipation, we want you to eat foods high in fiber, whole grains, breads, nuts, cereals, raw fruits and vegetables will be help with your digestion. Staying active helps. If you're lying around and sitting down, or and I get that sometimes you are tired, but it's really important to get some exercise in because that'll help your bowels to digest and move as well. Prunes and prune juice are very effective, especially if you heat up the prune juice and drink it. It's usually very effective. If you have not had a bowel movement in a day or two and you're having difficulty, then you need to notify the physician so they can prescribe something for you because there are prescription medicines that they can give you for this side effect. But diet is really important with the diarrhea and the constipation, so be mindful of that to try to avoid these instances. So, as I mentioned, our red blood cells, white blood cells, and platelets are affected by chemotherapy. Now, our red blood cells, as you know, or you may know, you will have blood work done prior to every chemotherapy treatment. And it's because the doctor is going to look at your labs and make sure that you're healthy enough to receive your next treatment. One of the counts we look at is your red blood cell count. These are the cells that carry oxygen to your organs and tissues. If your count is low, the doctor may hold your treatment, may order a blood transfusion if it's very low, but it's something that can be fixed and then you can receive your next treatment. A lot of patients worry that it's going to delay them from getting their treatment or they'll have to skip a treatment, which will never be the case. You will receive your treatment once your blood count is elevated to where it needs to be. You might not have any symptoms when you have anemia. Some patients do experience dizziness or shortness of breath, or they may have a headache for an unknown reason. The main way we see the anemia is through your lab results. If you have these symptoms, get plenty of rest, eat well. Foods high in protein and calories are really important while you're receiving your treatments. And like I stated, some patients do require blood transfusions to get their blood counts back to normal so that they can receive treatment. The other side effect, bleeding, is caused by low platelet count. So platelets are a cell in our blood which help with blood clotting. And chemotherapy does affect this cell as well. So we look at this number through your labs. However, if you find that you're having frequent nosebleeds, if you find blood in your urine, if you cut yourself and the bleeding, it takes a long time for it to stop, those are signs that your platelet count might be low. So you need to let the doctor know as soon as possible. Obviously, if you're bleeding from somewhere, from a cut, a wound of some sort, you should go to the emergency room and let them know you're on chemotherapy. They'll probably look at your counts and take care of you there. but these are signs to let the physician know that your blood count or your platelet count might be low. Another thing, you might see some unusual bruising, or we had a patient come in saying she had a rash, but it was these red dots all over her skin, and it's because her little blood vessels were bleeding. So they were showing up as like, it looked like a rash, but she was actually had a low platelet count. Bleeding from your gums when you brush your teeth, if that's uh, con- constant for you every day, or you see more bleeding than usual, you need to notify the doctor as well. Ways to prevent bleeding. So there's a couple of things here. Use a soft bristle toothbrush. Blow your nose gently. Make sure you're eating right to prevent constipation, because that can be an issue as well. Gentlemen should use electric razors, not disposable razors. They're safer and won't cut your skin. If you're on blood thinners or aspirin-based drugs, your doctor probably knows about that already and will recommend you how to take them or stop them or continue them. You should avoid dental floss or toothpicks. And the reason that is your mouth, which can enter your bloodstream and cause other problems. So the dental tape, which is like dental floss but flat, can be used because that's gentler on your gums than the actual dental floss. Avoid playing sports or doing any other strenuous activities where you can get hurt. Avoid use of tampons, enemas, suppositories, rectal thermometers. Again, no disposable razors, and no wearing of tight clothing, like tight pants, or where the wrists are, say there's an elastic on the sleeve or that sort of thing, because that can cause bruising or bleeding as well. So infection is a big side effect of chemotherapy, and we as nurses work really hard to prevent any type of infection in our patients. The white blood cells that go through our bloodstream are the cells that fight off infection in our body. When this count is low, you're at risk for infection. So this is one of the parameters we look at as well when you before you come in for treatment. If your count is too low, the doctor will hold or delay your treatment, because we will not give you chemo which will knock down your white count even more. The white blood cell count does decrease after each treatment, and 7 to 10 days after your treatment, it's at its lowest, and that's when you're most at risk for infection. So everyone should have a working thermometer in their home. If you start to feel ill, I always tell patients, check your temperature, write it down. If you're still not feeling well in a couple of hours or you feel worse, check your temperature again and write it down. If you start seeing it trend upward, then you need to call the doctor or go to the ER. It's really important for you to get checked right away if you develop a fever of 100.5 or higher, because that's indicative of your body trying to fight off some type of infection. Hand washing is the most important thing, as we learned through COVID. Hand washing, hand sanitizer is effective as well. Wiping down things in your home, common use things, refrigerator handles, doorknobs, light switches, door rims, that sort of thing, where people touch frequently. It's a good idea to wipe them down, because you never know what can be brought into your home or in public. Take some in your purse and wipe down the ATM machine before you use it, or when you use it to open a door or whatnot. It's really important to protect yourself from infection, because you can become very ill if your body won't have the defenses to fight off an infection if your blood count is low. Shower or bathe daily. It's important to get there's normal flora on our skin, or bacteria on our skin, but that's why we bathe frequently, to get rid of that. And being on chemotherapy, you want to reduce that risk for infection. So staying clean and bathing frequently is recommended. And of course, stay away from anyone who's not feeling well. Avoid crowds. Nobody needs to come and see you if they're not feeling well. Um, in this day and age, as we're doing now, you can FaceTime, you can do a virtual call. They can call you on the phone, but the best thing is for them not to visit you. Just try to stay away from them. Also, avoiding large crowds because you don't know who is ill in those crowds. So, what are some signs of infection? A temperature of 100.5 or higher. That's a threshold that we go by for our chemotherapy patients. You should notify your MD or go to the emergency room. If you do have to go to the emergency room, the best thing to do is let them know that you are a chemotherapy patient, because the first thing they're going to do is check your blood counts to see where you're at, and then they usually will notify your physician. Any areas of redness or tenderness on your body, if you have a boil, if your fingernail is red and puffy, um, uh, any chills or shakes, sore throat, mouth sores, cough with yellow or green sputum, itching or burning in your genital area, frequent urination, foul smelling urine, diarrhea can be a source of infection, and shortness of breath as well. You can have a lung infection. So these are all signs that you need to be seen, or you need to let your doctor know what's going on for direction. Because again, your body won't have the defenses to fight off these infections. So loss of appetite is also known as anorexia. It is common with chemotherapy. Chemotherapy does affect your taste and your smell. Um, Things don't taste good, things don't smell the same, and sometimes these things can cause nausea as well. So, a way to manage the anorexia is again eating those small, frequent meals, keeping something in your stomach at all times. Water, patients have said it tastes metallic, so add cucumber, lemon, mint to your water. Just make sure your fruits and vegetables are washed well, or the mint is washed well, and add it to your water. Candy, keep some hard candy, or ginger chews in your purse, something to keep the mouth moist. If your mouth is dry, then you really don't have an appetite, so you really want to keep your mouth moist. And again, drinking that water will help with that. Eat when you're most hungry. Um, there might be a time of the day, of the morning, that you're most hungry, and eat what you want when you want. Don't stick to the 3 meals a day. Um, you can have high calorie foods, high protein foods are really important. I tell patients, go to In-N-Out, get that shake and that double if you want. That's a lot of calories, and it's good for you at this time. The protein, the calories are good for you. Your body needs that to sustain the chemotherapy. Um, there's also those Ensure drinks that you can purchase over the counter. Those are high in protein. Those can replace a meal if you're really, really having trouble eating solid foods. Those are very nutritious. They have a lot of calories, a lot of protein in them. So we highly recommend those to patients who don't want to eat solid foods. And there's so many flavors out right now. So you can pick and choose which flavor you like and kind of stick with that. But it's really important to eat. Nutrition is really, really important during chemotherapy, to help you throughout this journey. And also, you can increase your appetite by doing something active, which we'll talk about a little bit later as well. Infertility and sexual changes. So, chemotherapy does cause infertility in both men and women. So, if there's someone who is planning on having a family, you need to discuss that with your doctor, or hopefully, your doctor's brought that up with you as well. Um, but even if you're not in childbearing years, there are changes to both men and women. Women may stop menstruating, or they may restart menstruating with chemotherapy. They can experience symptoms of an early menopause, the hot flashes, the vaginal dryness, symptoms of that sort. There are some products that the doctor may recommend for this if you're having a lot of trouble with it. Men will have decreased sperm counts and erectile dysfunction as well. So it's very important to avoid pregnancy, for both men and women. and use of protection is recommended very highly. Any questions?
I don't see any right now, but I'll keep my eyes peeled.
Thank you. So fatigue. Fatigue is the only one of the only side effects that we do not have a medication for. So what research has shown is that daily activity helps with fatigue. And sometimes when you're going through chemotherapy, you do not want to do anything but lie in your chair or your bed. But we want you to get out and do a 10-minute walk, one way, 10-minute back. That's 20 minutes of a slight activity. That's going to help with your digestion, your constipation. It's going to help increase your energy level. Some patient asks, can't you do gardening? Yeah, as long as you're wearing your mask and wearing your gloves, you can do gardening, but only to what you can tolerate. It's really important for you to rest when you need to rest. I tell patients dishes can wait, laundry can wait. That's not important. If you're tired and you need to lie down, then you need to lie down. And this is where you incorporate the help of family and friends who want to do something for you. I say they will be so happy to go in and do your dishes if you tell them, you know what, I can't get around to doing my dishes. It's going to make them feel good, and it's going to get one thing off of your plate to worry about. So utilize the help that's offered to that people offer for you. This is the time to do it, and don't be ashamed to say, I can't do my laundry. Can you please do my laundry? Because they want to do something. If they're offering, they really want to do something for you, and it's going to make them feel good. So, and let you get the rest that you need as well. So please utilize any help that's offered to you. But again, take your break as needed. Do activity to where you can tolerate. Don't overdo it. We don't want you to do anything strenuous, but just to get out there, get some sunshine, get some fresh air, short walk. Take somebody with you. Take the dog with you if you want. But daily activity is what research has shown to help with fatigue. And fatigue can be caused from your medications, from you not eating right, from other medical problems that you might be having. So be mindful of that. And it's I feel so bad that we can't really do anything else other than give advice on this, because I know fatigue is real. We see our patients come in after a couple of cycles of chemo and they look really tired. So it's really important. And if you find that you can't even stick to your daily routine, then you need to let your doctor know, because there might be something else going on that they need to check into. And I can't believe I'm done already. Is there any questions?
Thank you so much, Dora. This was so informative. Nurses give such a gift, and one of the gifts is this incredible knowledge. So we really appreciate you sharing it with us. I'm going to stop the recording, and I want to invite